Today we're going to be talking about your heart. Your heart is amazing. It has 4 chambers, and these 4 chambers help in pumping over 1 gallon of blood every single minute. But sometimes things go wrong. One thing that can happen is mitral valve regurgitation. Mitral valve regurgitation can go undetected for a really long time.
But when you start experiencing symptoms, this can sometimes be when it gets discovered.
Let's break this down. What does mitral valve regurgitation mean? Regurgitation means backflow. I'm sure you all know about how birds feed their young. The mama bird chews up the food, then she spits it out into the waiting baby birds' mouths. This is pretty disgusting, but if you think about this, it'll make a lot of sense as to why the mitral valve is important and why mitral valve regurgitation is bad. Here's a bird regurgitating food into the baby birds' mouths. The mitral valve is located here on the left side of your heart. The mitral valve will be here. This chamber is your left atrium, the top chamber of your heart, and here is the left ventricle. Normally, oxygenated blood returning from the lungs will enter this left atrium via the pulmonary veins. All right, so the blood comes in here in the left atrium, and then it continues down to the left ventricle and is eventually pumped out through your aorta. But sometimes this mitral valve does not work properly. Now, to think about what's going to happen in mitral valve regurgitation, I want you to think about those times when you flush the toilet and you look back and it's not going all the way down. It does go down, but then a little bit of water comes back up. And then you're thinking, should I flush again? Should I not flush again? Mitral valve regurgitation is just like that. You don't want that water coming back up into your toilet, and similarly, you don't want your blood coming back up into your left atrium. With mitral valve regurgitation, there's a problem with your mitral valve. Normally, the mitral valve exists in between the left atrium and the left ventricle so that the blood goes the way that it should.
From the left atrium to the left ventricle, and then it continues on to carry oxygenated blood and nutrients to your body.
There are a few reasons why your mitral valve will not work properly. There are just a few causes of mitral valve regurgitation, and they are as follows. The first one is scar tissue. Much like your toilet, which probably isn't flushing properly because it's a little bit clogged, similarly, scar tissue can form on your mitral valve, preventing it from closing properly and allowing that blood to flow back up into the left atrium again. Other causes include infections like endocarditis or rheumatic fever. You may also develop mitral valve regurgitation because of mitral valve prolapse. Mitral valve prolapse is a problem with your mitral valve. Let's look into that a little bit. Normally, your mitral valve looks like this, but during mitral valve prolapse, part of your mitral valve will be going up into the left atrium. And this can cause mitral valve regurgitation. It can cause that blood that's supposed to go from the left atrium down into the left ventricle to go back up, just a little bit of it maybe, back up into the left atrium. So how do you know that you have mitral valve regurgitation? Let's look at our symptoms. The symptoms of mitral valve regurgitation are few and far between. In fact, you may have mitral valve regurgitation for years before detecting it. The first symptom is dyspnea. Dyspnea, or difficulty breathing. This can happen over a long period of time. Maybe at first you feel like you have a hard time breathing, then all of a sudden you notice over the years that it's more and more difficult. This could be a sign that you have mitral valve regurgitation. The second symptom is going to be fatigue.
This isn't just waking up and thinking, wow, I wish I got more sleep last night. This is an all-body tiredness.
And when you go to the doctor, they can listen to your heart, and sometimes they can hear a sort of click, and this could be a sign that you have mitral valve regurgitation. So how is mitral valve regurgitation treated? Depending on the cause, there are many different treatments available. If you had an infection, your doctor may prescribe antibiotics. Sometimes you may just need bed rest. You just may need to rest, give your heart a rest, and things will improve. And in some cases, you may need surgery. Fortunately, the surgical options, sometimes if you have scar tissue, you may need to have that scar tissue removed. And sometimes you may actually need your valve in your heart to be replaced. You might need this mitral valve here to be replaced with an artificial part. And the success rate of this surgery is fairly high, so this can definitely be a good option for treatment. Fortunately, mitral valve regurgitation can be treated, and it can be prevented if you keep your heart healthy.